All right. Again, thank you very much for joining us today. I think we had a couple more people that joined. And we'll go ahead and get started. Again, I'm Mary McCaskill from Southern Regional AHEC and the Regional Extension Center. And we put together the webinar today for Avoid the Penalties. We have a lot of practices that bill with CMS, and there are several programs that there are some upcoming penalties in 2014 and 2015, so we just wanted to make sure that everyone's aware of these penalties and the steps they can take to avoid these. If you have any questions during the webinar, we're going to try to save the questions toward the end. We should, the presentation runs about 20 minutes, so there should be plenty of time at the end for questions. And but if you have anything immediate, you can, on the panel, you can raise your hand and we'll try to address those as they come up. So we'll go ahead and get started. A little bit first about, so you might have seen in the emails lately the name Healthcare Quality Solutions. And Healthcare Quality Solutions is actually a consulting group that we started with the Regional Extension Center here at Southern Regional AHEC because we had specialty practices as well as some of our primary care practices that are in need of our services, but through our grant we weren't able to offer those. So we now have a fee-based consulting service, which is Healthcare Quality Solutions, that is available here at Southern Regional AHEC. The practice support consultants here offer information, technical support, and assistance that focuses on best practices to promote continuous healthcare improvement in our region. And also, with that, we offer quality improvement and practice support, such as meaningful use, PCMH, PQRS assistance, EHR vendor selection and implementation, EHR optimization, and technical support. So if you have any questions about those, you can contact us. This is our team here at Southern Regional AHEC. And also I'll note here that these slides should be posted on our Southern Regional AHEC practice support site hopefully within the next week or so. And also if you send me an email, I'll be glad to mail these to you, email these. And so here's some contact information for our consultants here at the Regional Extension Center. So we'll go ahead and get started with kind of the meat of the program today. Our objectives today are to identify CMS programs that have upcoming penalties, a brief overview of these programs, and it's really a brief overview. It doesn't really dive into the program themselves, but of course, again, if you have questions, let us know. The timeline and associated penalties, and steps to take to avoid the penalties. So the programs that we'll be talking about are e-prescribing, which now at this point, I don't think there are any incentives left with that program. It's basically payment adjustments if you don't meet the criteria. Also the EHR incentive program, which is meaningful use, and the physician quality reporting system, otherwise known as PQRS, and it used to be known as PQRI. And as an overview of all of these, I guess one of the first questions that people ask is, am I eligible for all of the incentives at once? And basically, you can do PQRS and either of the other two, receive incentives with either of the other two, the e-prescribing or the EHR program, but you cannot receive incentives for the e-prescribing program and the EHR incentive program. And so I'm going to put this slide up, and it's a bit confusing and kind of busy, and I've looked at it several times trying to figure out exactly what it's telling me. But I guess the big part is if you look at the bottom in 2015, you start to see where the payment adjustments are coming into play for the EHR incentive program and the PQR incentive program. And these penalties are actually affected by actions that are taken in 2013 and 2014. So that's kind of what we're going to talk about today is how to avoid these 2015 penalties. So we'll start with the e-prescribing incentive program. The e-prescribing incentive program is a reporting program that uses a combination of incentive payments and payment adjustments to encourage electronic prescribing by eligible professionals. EPs who are not successful e-prescribers and do not qualify for a hardship exception will be subject to a payment adjustment equal to 1% of the Medicare physician fee schedule allowed charges in 2012. So those have actually already come into effect, and you may have received a letter or report from CMS about those penalties. So the payment adjustment increases to 1.5% in 2013 and 2% in 2014, and actually any of the actions to avoid the 2013 penalties should have already been taken. So what we're looking at now is trying to avoid the 2% increase of payment adjustment in 2014. So the best way to avoid these penalties is to adopt a qualified e-prescribing system, or actually most people now, or most practices are implementing an EHR that have the e-prescribing capabilities, and then report the e-prescribing measures either by claims-based reporting and reporting the G-codes that are listed there. New in 2013, there's also registry-based reporting, which is similar to, and actually I think the same registries that are used for the PQRS program, as well as there are some EHRs that are set up to electronically send that e-prescribing information to CMS. When I looked at the list, there's only two or three EHRs on that list that that I've seen being used in our region. But if you have any questions about that, let me know, and I can look and see if your particular EHR is on that list. So some other ways to avoid the e-prescribing payment adjustment is to file a hardship. There's several hardships. If the provider isn't a physician or isn't eligible based on primary taxonomy code in the NPPES system, if they don't have prescribing privileges, then they need to report a G code, the G8644, by June 30th, 2013, just saying that they don't have prescribing privileges. If they don't have at least 100 cases containing an encounter code, so basically if they're not seeing anybody in a practice situation, then that would need to be reported as well. If they don't meet the 10% denominator threshold between January 1st, 2013 and June 30th, 2013, and that is basically if 10% of their denominator or the encounters and patients are not, I think if they're not Medicare patients, then that would be a hardship as well. And also the good one that has come about in the last year, it came out at the same time as the Meaningful Use Stage 2 final rule, is that by achieving meaningful use, if you achieved meaningful use in 2012, it actually prevented you from the payment adjustments in 2013, and it'll work the same way for the 2014 adjustments if you have registered and attested for meaningful use in the Medicare program, or attested to adopt, implement, or upgrade for the Medicaid program by 6/30/13, then you will actually avoid the penalties for the e-prescribing piece of it in 2014. I guess a question come up. Let me try to clarify and go back. Does all this apply to Medicaid? That's a good question. I think it does, but I think when you look at Medicaid I think you also have to look at whether or not what your, I guess, how many Medicare patients you're also seeing, and what percentage of that the penalty will affect. And so I guess I'm thinking of pediatric practices who really don't see a large Medicare volume or percentage of their payments, then it really wouldn't affect them that much. But if you see Medicaid and Medicare patients, then it would just apply to the Medicare portion of your payments. I hope that answered the question, and hopefully going forward we'll offer some more information that might help. I'm going to talk about the EHR incentive program, or meaningful use. And I just want to add in here, so one of my practices has affectionately begun calling me Meaningful Mary, so everybody's allowed to call me that. And but for meaningful use, the Medicare, Medicaid, EHR incentive programs provide incentive payments to eligible professionals as they adopt, implement, upgrade, or demonstrate meaningful use of certified EHR technology. The penalties begin in 2015 at 1% based on program participation in 2013 and 2014. And before I go through the next slides, it's really based on when your first year of attesting to meaningful use, when that started, as to whether or not it will affect the payment adjustment in 2014. However, if you don't do your first year attest for your first year until you have to have it done by October of 2014 and still avoid the 2015 penalties. So I just want to say that, but there's a couple visuals here that will help explain that a little bit better. I do want to point out that there's still, in both the Medicare and Medicaid meaningful use programs, there's still incentives available. Even if you start in 2013, you can still receive $39,000 over the life of the program, and the first year is $15,000. And for Medicaid practices that see at least 30% Medicaid volume, then they have until 2016 to begin the process. So going back to some of the payment adjustments for the different eligible professionals, if the professional demonstrated meaningful use in 2011 or 2012, then the next year, 2013, then they'll need to attest for the reporting period for the whole year of 2013 to avoid penalties in 2015. For eligible professional who demonstrates meaningful use in 2013 for the first time, so this is their first year, then based on the 90 days, since it's their first year attesting to meaningful use, then they will avoid the penalties by attesting for a 90-day reporting period in 2013. And then, like I was saying, for anyone, if they start their first year in 2014, they have to attest by October 1st of 2014. So I know that that's really confusing to go through all those dates and trying to figure out exactly, especially if you have multiple providers in your office and you're trying to figure out who's eligible for what and when. So again, these slides will be available, and if you have any questions, you can contact me and I'll be happy to answer those. So some steps to avoid the penalties is basically meeting the meaningful use criteria. So to do that, you need to check to make sure that you have an O&C certified EHR, run the meaningful use reports from your EHR, and perform a gap analysis to find out which measures are being met and which ones are not. Identify and rectify any technical barriers to meeting the measures, develop and improve workflow to meet the measures, and then register and attest for the incentives by October 2014. And that should enable you to avoid any penalties in 2015 for the EHR incentive program payment adjustments. So then the next program, and this is probably the one that people that I've talked to, and us included, have kind of put on the back burner. It's kind of a confusing program when you look at even the getting started page. when you look, there's so many different options and different ways you can go to report this. But basically, the Physician Quality Reporting System is a reporting program that uses a combination of incentive payments and payment adjustments to promote reporting of quality information by eligible professionals. To avoid the 2015 PQRS payment adjustment, individual eligible professionals and CMS selected group practices will have to satisfactorily report data on quality measures for covered professional services provided in 2013. So again, this is to avoid penalties in 2015, then you have to report in 2013. And so the way that, to start working on PQRS is first to determine the eligibility for the provider, and really it was, when I looked at the list, it was very inclusive of a lot of people, most physicians, other practitioners such as nurse practitioners and PAs, as well as some like physical therapists were on the list. And I have a copy of that list, and it's on the CMS site if you need it. The next step would be to determine the reporting method. There are 3 different ways you can report. There's claims-based, where you submit different codes based on different quality measures. There's registry-based, where you put the information into a registry and then the registry sends that information to CMS for you. Or again, it's the same list as the e-prescribing program. There are some EHRs that you're able to electronically report from that, but there aren't. It's a small list compared to the number of EHRs that are out there. And then the next step is to determine a reporting option. So you can report on either individual measures, and I think with the individual measure reporting, then you actually look at 80% of your total patient population and the different clinical quality measures and how they fit in there. Or you can pick a measures group, and with the measures group, you're looking at 30 Medicare patients and how they fit in within the different quality measures. So that's kind of the difference between the individual measures and the measures group, is the population that you're looking at to report. And then, of course, reporting those measures to CMS would be the next step. I also wanted to put in here, physicians who are incentive eligible for PQRS can receive an additional 0.5% incentive payment when maintenance of certification program incentive requirements have been met. And this is a physician-only incentive that will be paid at the same time as the 2013 PQRS incentive. So I'm not sure how many people are aware that that extra incentive is out there. So I wanted to put that in. And so that's kind of an overview of the 3 different programs and the penalties that are associated with those, and kind of when the penalties will take effect. And so just looking at it, there's several ways that that these programs overlap. You can meet the e-prescribing criteria by successfully attesting for meaningful use, which I think is a great thing that they've added. And I also want to add with that there's no reporting mechanism, which makes it nice. So supposedly CMS is going to actually before they start any of the e-prescribing penalties, they're actually going to look at the EHR incentive program registrations and see who met that criteria. You can also use the same clinical quality measures for PQRS as you do for meaningful use. So if you're working on the diabetes measures for your additional clinical quality measures in meaningful use, those are also measures that would be applicable to PQRS that you can use. And also, like we were saying, there are a few EHRs that you're able to electronically submit e-prescribing information as well as the PQRS data starting in 2013. And so again, just to kind of recap and looking at the deadlines, then for e-prescribing, the professionals who are not successful e-prescribers and do not qualify for hardship exception will be subject to a payment adjustment, and right now we're looking at that 2% in 2014 is what we can actually work on now to avoid. For the EHR incentive program, it's a 1% payment adjustment in 2015 based on the providers where they're at in the meaningful use program, the EHR incentive program. And then for PQRS, in order to avoid 2015 penalties, then the PQRS quality measures need to be reported in 2013. So that's just kind of an overview of the different programs that are out there and the different penalties that are coming up and the different time frames that we're looking at there. I also put these helpful links. These are on the CMS site. They have the Getting Started pages, which are really great. I mean, the Getting Started pages are, I mean, it has good information, but what I usually look for is either on the left, they have different links that will help answer a lot of questions, as well as at the bottom, then they have a download section. So I know, for instance, PQRS, there's an implementation guide at the bottom of the Getting Started page that you can download. And of course, we're here to help anybody that needs help with these things, and just let us know. And so I guess if anybody has any questions, then we can start taking questions. And again, does this apply to Medicaid also? I think we were talking about the e-prescribing penalties, and so hopefully I answered that question. Does anyone else have any questions? I'll give it maybe 10 or 15 seconds or so. And if anybody has any questions, let's see. Someone has asked, is Allscripts one of the EHRs that can submit? Unfortunately, no. Allscripts is not on the list for the e-prescribing and PQRS electronic submission. So, but I mean, don't feel lonely. The three that I saw that were on there that I know we have practices that have, although there aren't very many. Aprima was on there, Success EHS, as well as, and there was one more and I can't remember, but I think we only had one practice that used it. So the big names like Allscripts, Athena's not on the list. Who else? Greenway's not on the list. So some of the larger ones, it's not available in those. Let's see. Okay, and then I guess kind of build on what we were talking about before. The penalty is the same for Medicaid. It's kind of hard to answer. They're the same. They apply for Medicaid, but they only apply at this point to Medicare charges. So any of your Medicaid charges, these penalties won't apply to. And I'm not sure if that answers the question or not, and we can kind of discuss that offline if I'm not answering that question well. So, are there any more questions? All right. I don't see any other ones coming up, and I appreciate everybody joining us today. And I know you're busy, and hopefully this 30 minutes during lunch was a good time to do this. And again, if you have any questions, let us know. These should be posted on our Southern Regional AHEC website soon, and just send me an email if you'd like for me to send the slides, and let me know if you have any questions. And again, thank you very much, and have a great day.